All right. Welcome to episode 13 of Real Women Real Estate. Woo
Whoop
woo.
whoop. So whoop, Angelica.
Woo woo.
Thank you, Dr. Garrett.
This episode will be featuring women's health and speaking with Dr. Angelica Garrett Wood. This pandemic has been described as a disaster for feminism by writers at The Atlantic. Gender dynamics are front and center, and this is tough on women at home during the pandemic. On this Mother's Day week, yay, we have a special guest to discuss the women's health during COVID. And before we introduce her, the quote for the day is, "When women take care of their health, they become their best friend," by no other than Maya Angelou.
My sorrow.
Maya.
I like it. So Dr. Garrett Wood is an assistant professor and serves as an assistant student clerkship director for the Department of OBGYN at Meharry Medical College. Dr. Garrett Wood completed her undergraduate training at Xavier University of Louisiana. She received her master's degree from Hampton University. She obtained her medical degree at Meharry Medical College. She completed her residency training at the Mayo Clinic in Rochester, Minnesota. Before joining the faculty at Meharry Medical College, Dr. Garrett Wood previously held a position at Kaiser Permanente Mid-Atlantic Permanente Medical Group in Largo, Maryland. My apologies for messing up that bio, but it's so good. And Dr. Wood is a wife and a mother to 3 daughters. When she's not mentoring her students, she enjoys just quality time with her family. And thank you so much for being here, Dr. Garrett. We really appreciate you on this Mother's Day weekend, Mother's Day week, and as a mother yourself, really appreciate your time.
Well, thank you for having me on. I've been dying to get on real estate with real women. I've been dying. This has been the top of my to-do list.
I appreciate it. I also want to note that you are an advocate for women's health. You're an advocate for women's rights and the women's right to choose. And you've also established an endowment created by you and your husband, Dr. Judson Wood, for a scholarship funded by you all for young medical students as well. So not only,
medicine and dental.
Okay. Medicine and dental. Thank you for that. So not only are you an advocate for women's rights, but also promoting young doctors coming up and an advocate for women's health, and which is what we're all about. And that's what this episode is all about. So we just kind of want to dive in a little bit and really get some understanding of just women's health in regards to this pandemic, and what are some things that we can do to, I'm sorry, I can't move my screen to get the questions.
So I'll go ahead and ask the question. So we are in the midst of our generation's first and hopefully only global pandemic. And I think I speak for just about everybody when I say that stress levels are at an all-time high. So we really just want to get your opinion on, from a high-level overview, what are the effects of stress on the body? And does stress impact women differently than it does men?
Okay. So, well, stress as a whole can have overall negative effects on the body in general. I'll speak from a women's perspective because I haven't dealt with the male anatomy since I was in medical school, right? So all that stuff is kind of out the window. But so with regards to stress, well, first thing, stress can change a woman's cycle, her menstrual cycle. She can, be thrown off, be irregular, have heavier bleeding. It can affect her premenstrual or menstrual syndrome. So if someone is moody during their cycle, or may experience maybe like a lot of like cramping or abdominal pain, that can be intensified by stress and stressful situations. Stress has also been linked to gastric ulcers. Obviously, if you are stressed, you're not sleeping well, you may not be eating correctly. So all of those play a role, with regards to diet and healthy overall lifestyle. What was the next part of your question? I'm sorry. It was a long.
Yeah, I just wanted to understand, like, kind of what you were answering, like, what's the effects of stress on the body in general, and if it, impacts differently than men. And I understand what you're saying as far as, you don't really work with the male anatomy. So we'll take that leg up.
Women, we take, stress also can affect fertility, because if you're stressed out and it throws off your menstrual cycle, then it throws off your ovulation cycle, then that throws off your fertility and able to, conceive in your normal pattern. So stress in general affects the woman, probably more than a man with regards in the physical aspect. London, I'm doing something.
Yeah. I think a lot of our audience is, entrepreneurs. We have a lot of real estate entrepreneurs. We have a lot of real estate agents who either are working for themselves or, working kind of like a high stress environment. And so we definitely want to speak to that audience. What are some signs we should look for within our bodies if we feel like we may be experiencing a high stress environment, or maybe like stress may be manifesting itself in a different way?
So physical aspects of stress in females can be like hair loss, like, do you mean like that? Like physical signs?
Yeah,
So like hair loss, like I said, change in your menses, headache, stress headache, tension headaches. So those are typical headaches that occur either, in the back of the head or in the temporal head. Let's see. And then if your stress leads you to panic attacks, then you can talk about shortness of breath, palpitations, or you're feeling as if your heart is racing and beating fast. With stress can also present itself in the form and lead to the form of, early signs of depression. So then you're looking at, signs of depression, like decrease in appetite, decrease in the desire to do daily activities that you normally enjoy, lack of sleep, or even if you're sleeping, multiple hours out the day, not feeling as if you've gotten adequate rest. Weight loss is always a sign of stress, or weight gain, depending on which type of stress person you are. Some people are stress eaters, meaning they fall into the comfort foods of snacks and junks to help relieve stress. And then some people are stress starvers, and meaning that they have no appetite when they're under stressful situations. So those can present.
That's me.
That's me.
Which one is stressful? Not
stress starver.
Yeah, those
have zero desire to eat.
Yeah.
I
think that's more common, the stress starving, because you'll see, a lot of patients with weight loss and so forth. But it's just because stress your stomach can be all torn up in knots, and then it's like, how can you even feel like you're eating anything,
Yeah.
But I mean, and then it's always important to have, I'm sure you'll probably get into this later, but it's always important to have like your circle that you can decompress and talk about your stressors with. And even if that is your physician, to have some type of relationship that you're able to, feel comfortable confiding in some of the stressors that are weighing you down, to help to see if, outside resources are what you need.
That was actually the next question. So you lead into the next question. During this time with the pandemic and everything that's going on, what are some tips for managing stress and anxiety right now that you would give to some of your patients?
Right. So what I give to myself, right? Because
to yourself, because
I've never worked through a pandemic. I never thought I would, walk into a pandemic, and never thought about having to, the potential to potentially infect or make my loved ones sick every single day I enter the house. That's a major stress.
Absolutely.
Right. So how are you?
But I think, so it's important to still find enjoyment in the things in the activities that keep you sane. You know, some people, it's not me, I'm not an exerciser, but some people, you know, find their comfort in exercise. My personal relief is me. I just need quiet time. So even when, you know, I have a break from my patients, I like to just go in my offices and just chill out, turn on my laptop and catch up on some of my, you know, reality TV. You know, you have to find something that you continue to enjoy. I mentioned that. So right now, you know, I think this is one of your questions as well, but right now, you know, many physicians have cut down on the amount of patients that they're seeing in their office, but you don't want to forgo certain visits that are important to, you know, keep your health maintenance up. And that includes like your annual exam. So like, although we are like distancing or spacing out, you know, annual exams, if you feel that you're at a point where your stressors are overwhelming you and you need to get in and speak to your doctor, those are important visits that we are seeing patients for.
That's good that you mentioned that, because I was just thinking that, you know, nobody wants to go to the doctor's office right now because everyone's like, this is not a safe place to be. And so much of the news is saying, don't go to the doctor unless it's an actual emergency. But how do you know, what's enough? Because I know that people are under stress. I'm under stress. Yeah. I have kids at home that I'm not used to caring for on a regular basis, on a 24/7 hour basis. Right. And I'm also trying to work. And my husband's trying to work. It's a lot. It's a lot to do, and I can see differences. Yeah, and I'm sure there are a lot of women that are dealing with this right now, and I can see difference. I can see differences in my skin. I can see differences in the pattern of my sleep, the way that this has just changed my schedule around, just throwing everything off. And there are moments where I'm just like, well, is just the sadness, or is this you know, there's these serious questions that you kind of think of, and so that's good that you bring that up. So your advice is, if you are feeling like this, go ahead and call your physician and talk to them about it and decide whether, you know, you need to come in.
Well, yeah, because this one thing that the pandemic has forced physicians and healthcare providers to do is become more innovative and use new methods to reach their patients. So a lot of us are doing either televisits or video conference visits. So even if you don't have to physically go in to see your doctor, the same way you have a Zoom meeting with your office, you can set that up with your physician, so you can see I can see my patient face to face. I mean, you know, as far as GYN issues, that, you know, sometimes that's not as beneficial to us, but for certain things that you may need to discuss, those visits work, you know, well with us, or even with your primary care doctor. But I know a lot of women use GYNs as their primary care doctors.
Yeah.
But yeah, so if you're concerned about physically going into the office, I'm sure many offices, because ours has, and I know a lot of others have, started to do these telemedicine, televisit, video conference visits as well.
I'm just picturing somebody like on a Zoom call and saying, "Hey, doctor, look at this. What do you think?"
That's where my mind went to, Courtney.
No, but the thing about it is, I mean, it's no different than, you know, your friends sending you a picture of something that
yeah,
we do.
The only difference is but it's on a secured line though, so it's set up through, you know, the system at, oh sorry, I lost you guys. It's set up at the system so that it's a closed or secure browser. So, you know, but I try to discourage that. If it's something that you think I need to see, then I need to see.
Like actually lay eyes on it.
Don't just do that over the Zoom call. That's where my mind went too.
No, but I mean, it's the truth though. I mean, as many emails that I've gotten with photos of things, you know, it happens.
Oh, I can only imagine. I wanted to touch on something that you said earlier in regards to having a circle to kind of help manage your stress and anxiety. I know Kim and I had a moment earlier today where we had a client who kind of pulled the "I'm overwhelmed" card.
Ooh.
And we can go there. And it kind of brought up a question like, hey, everybody's overwhelmed. Like, everybody's going through something. Like, how, and this may be a little bit outside your wheelhouse, but like, how do you manage that conversation when people start to talk about feeling overwhelmed to the point where they can't do like, you know, business, or they can't just do like, have like a regular conversation? Like, is that something, and this is from a non-doctor standpoint as well, just like as a homegirl, like what is your conversation when somebody starts to talk about feeling overwhelmed?
Suck it up, buttercup. No.
Yeah, because I really did want to tell sis, like, ma'am, get over it. But I know that's not healthy, so
I mean,
we'll leave to you.
That's hard to say though, because like I'll give you.
It depends on the situation, right?
Yeah, I agree. So like I'll give you an example. So for example, I worked all the way up until my water broke with my daughter, and I would have my patients who were pregnant come in at like 28 weeks talking about, I need to come out of work because, you know, my back hurts because I'm sitting or something. And I'm thinking to myself, I'm still doing surgery and everything, but you want me to take you out of work, right? So you have to take into account other people's situations, but also disengage yourself from their situation, right? Because not everybody can handle the same things that you can, right? So it's easy to project your own thoughts of how someone should be handling their situation, right? But the way that they need to handle the situation may be differently. So as a homegirl, I try to listen and offer my advice or help where I can. But then if it gets to the point where I just feel like you're just, oh, woe is me, then I'm also going to be the homegirl to be like, okay, you got to snap out of it a little bit.
Yeah. I think one of the things that, you know, the moment that Kim and I had was like, as women of color, I feel like oftentimes we do a lot of like pull ourselves up by our own bootstraps and kind of like take it on the chin and keep pushing. But I could think of several instances, and you know, not saying this is a race thing, but I could think of several instances where I've seen people like Kim or Courtney or like other women of color who are like really out here doing it, like do some amazing things as women and as mothers, and you know, not really complain, not think twice, just kind of take it and keep going. And so, you know, it is a different perspective to be like, okay, everybody has to reframe it. But also, I just want to give women of color that space to say it's okay to feel like you're overwhelmed, and don't think you have to. Do you understand what I'm saying?
Yeah, well, it's a cultural thing, right? Because your mothers did it, their mothers did it, and so forth, right? So it's engraved in the Black woman or women of color to feel as if, you know, they have to handle the world and pick up and keep going without missing a beat, right? And there's no time to mourn, no time to wallow, right? You just have to feel like you have to keep going. That's just what we kind of have ingrained in us. But that's why you need that group of friends that can listen to you vent for your 5-10 minutes or whatever, and then you go right back on without your day, right? Everybody needs that set of friends that they can just, you know, let it out real fast and pick up and keep moving.
Without judgment. You know what I mean? Without judgment, to be able to just have a free and a safe space to vent. So no, that's real. So our next question, just kind of want to dive into, how has your practice changed since the start of the pandemic?
Yeah, I kind of started talking about that. Yeah, so, you know.
And then touch on, and then in regards to the front lines, you know, have you gone through with testing and, you know, some of those things like that, you know, how have you been in the front lines?
Sure. So I was kind of talking about it with our practice. You know, we've spaced out the visits a day. So typically we would try to stack them. So OB patients we would see every 30 minutes, GYN patients we would see every hour. We've spaced that out. So maybe I'm seeing, instead of seeing about, you know, 10 patients in the morning and 10 in the afternoon, I'm probably seeing about half that in the morning, half in the afternoon, because the room has to be fully turned over more completely than it was before. Not saying it wasn't thoroughly clean, but it's like extraness that has to go into preparing the room for the next patient, and the screening. So each patient has to be screened before they even enter into the hospital, before they even enter into our clinic. So that takes some time as well. We've incorporated televisits, so using talking on the phone or the Zoom video. And then I've also actually postponed some people's visits. For example, annual exam woman, a visit for a 21-year-old, and if her pap smear is current, but she just wanted STD testing. Okay, I can just order that for you for the lab. You don't physically have to come into my office. Things like that. I've spaced out OB visits. So typically, I would see my first trimester and second trimesters every 4 weeks. Well, I've spaced that out to like 6 weeks. So, some of those things have changed that, we may consider doing as we move forward and this pandemic is over. With regards to my front line, Meharry is a testing site, a COVID drive-by testing site. So I did operate that for a few days. Now, actually, our president has taken over all the testing sites in Nashville, and he has he has told the mayor that Meharry will staff all of these sites. So now we're going to see how that's going to work out, because there's about four sites in Nashville that now we're going to have to take over. Regards to actual patient contact, I've had a handful of COVID pregnant women. Just delivered one the other day. She did well, baby did well.
And was she able to breastfeed her baby? Was that a normal, after?
Yeah. So she was 100% positive. She had a positive test. She was short of breath and had a cough, and she was satting, meaning that her oxygen saturation, or what we measure the amount of oxygen in the blood, was about 88% without any oxygen. So normally a normal person like you and I talking, our oxygen saturation is between 97 and 100%. So she was down to 88%, talking you and I. So that means we had to give her, supplemental oxygen, and we were able to do it through just the nose and not being her needing to be intubated. So with that, a truly COVID positive patient, ideally you want to talk to them about discouraging the actual act of breastfeeding, meaning placing the infant directly to the nipple, but the breast milk itself is still, the best choice for baby. So there hasn't been any study to date showing that the COVID virus transmits from breast milk. However, some women need that direct breast contact in order for their milk to stimulate. Sometimes the pumping doesn't help some women. So then if that's the case, that's the mom's decision to weigh exposure versus the desire to breastfeed, right? So if she desires to physically the act of breastfeeding, then you encourage, she wears a mask while she's breastfeeding. Aww. Good hand washing and cleanliness. And then once the baby's done, then immediate isolation again. So she, because she was on oxygen and not able to hold her own saturation without oxygen, she ended up having to be separated from the baby, and so they went into isolation. Oh, wow. So once mom and baby get separated, unfortunately at our hospital, that means the baby was put in general population or with all the other normal healthy babies. So then mom could no longer go see that baby, because it would then expose all the other babies. So they were reconnected on their third day when they got dismissed together.
How long does this take? How long does this last within the body? When will she be when will you be reunited with your child? Is there studies to that?
She was reunited when she went home. So okay. I understand what you're saying. So when she got dismissed on day 3, baby was doing well. Baby was dismissed. They were dismissed together. Now what they do at home is all you can do is advise her to self-isolate until her symptoms, improve
Subside.
or the 14 days, right? But as a mother, how can you self-isolate from your newborn baby, right?
Exactly.
You missed that bonding time. You're probably the one who's doing most of the care for the early newborn anyway, right? So then it was just, we sent her home with massive amounts of masks, and we just, reiterated, hand washing and all of that. Pray and just, a prayer that the baby doesn't wind up with the virus.
So if you are right now, if you have a birthing plan, and this birthing plan was in place prior to COVID, and we've been trying to get pregnant, we're doing in vitro, we're doing all these things, or maybe we're just trying to have a natural pregnancy right now. Are you advising to hold off on your pregnancy plan and change your plan altogether? Or are you saying go through with your plan?
So unfortunately, if for women who are doing IVF, their plan has been made for them. IVF is not happening right now. That's seen as an elective procedure, and we have not. Well, we are just now starting to get back in the phase of doing elective procedures. So from about March to Friday, we have not been doing any elective procedures. So any patient that was in the IVF phases during those times, basically their IVF was shut down, and they were just left with medications and drugs and off their schedule. So I don't know how many people have been through IVF or no, but it's a very expensive process. And once you're in it, to have yourself withdrawn from it, it's obviously disheartening, and it costs a lot of money.
Right. I was about to ask that. Like,
it costs a lot of money.
How are they redoing that? They have to pay all over again for that, because it isn't a very expensive process. I know a couple of people going through it now.
Right. So I don't know. I can't speak to how practices have worked that out, but I can only imagine that they would have to, you're starting over, because with IVF, there's certain times that you have to, use certain hormones to trigger the response, and it's all has to be calculated on days. So once you're off of the schedule, it's basically like you're not even doing it. So you have to come back in and start again. So I can't speak to how the financial aspect of that is, but I'm sure it's a burden to the patients. But if if you're blessed to be able to conceive naturally, no, I wouldn't delay, your desire to conceive based off of, the COVID-19. I was asked, if when the vaccine comes out, should pregnant women get it? And I'm going to be an advocate and say, I don't know the answer to that, because we don't know the type of vaccine that it will be. Certain vaccines you cannot give in pregnancy, like live vaccine. So live vaccine is like chickenpox vaccine that we give children, or the measles, MMR vaccines. Those type of vaccines you can't get in pregnancy, but you can get like a flu vaccine or a hepatitis B vaccine in pregnancy. But we don't know how the COVID vaccine is going to, what is it going to be composed of. I wouldn't delay, my plans if I'm able to, naturally, conceive. What I would say, my advice for women who are currently pregnant now, is know your doctor's practices rules, and know the rules of the hospital that you are trying to deliver at. For example, many doctor's offices are not letting you, are only seeing the patient, so you can't have an extra person at your visit. And I know for a fact, one of my colleagues, his wife is pregnant. He found out the hard way when he went to go for the ultrasound that he wasn't allowed to go back, because we're only just seeing the patient to minimize exposure.
Exactly.
In many hospitals, ours included, you can only have one support person. So nowadays, women are using doulas and having their significant other, partner, whatever. You would have to choose between who's the person that's going to be there with you. So I would recommend knowing the hospital you want to deliver at, their policy, their visitor policy, moving
for your
forward.
birthing plan.
Yeah, absolutely.
Yeah. Well, my niece was just born on April 20th, and we did a family Zoom, to see the baby be born. And luckily, my brother got a chance to be there, but it was very unique, unique experience.
Yeah.
Different and weird.
Yeah, it was. I mean, yeah. Luckily, she was healthy, the baby's healthy, everything's fine. But just imagine like problematic births, like having to not being able to be there for the mother and the child. So.
Yeah, so even with the patient that I just delivered that was COVID-19 positive, her husband was allowed in the room. He was negative, but I mean, he was, dressed in his PPE as well. And then it's just a different time for us ourselves. Like, I had on, a mask over a mask, and then a shield, and then scrubs over, and with a gown on top, with another gown on top of that. Like, so being in that room and with all those layers on, it's just it's a lot. It's hard to it's hard to explain. Like, you just feel just hot and wet. You going to bed? I have to tell my daughter good night. Sorry.
It's okay. This is our Mother's Day episode.
Aww.
So, and this is Mother's Day week. So
right.
Yes. So this is a celebration of that. And this is, it's real that my kids are in the background right now doing God knows what while we're on here. So it's all very real. And this is exactly what we're living. We're living this right now. And it's just a weird, unique time to be living in. And I heard someone say, I got this from somebody, that it could have been one of you guys, that we're the chosen ones. We're the chosen ones to kind of go through this right now. So I guess there's something to be said about our strength, and, we won't go through anything that we can't handle. So what I want to change gears just a little bit, right? And
let's lighten the mode.
there are some of us that and I think the start of the pandemic and just the start of being at home, if you are a married couple, was unique in itself too, because I know that some of my friends were just saying like, hey, my husband thinks that this is a free for all, or, this is just the new normal, just being here all day together like this, and things, of course, subsided and back to normalcy. But, what are, and this is kind of a taboo issue. And I really don't understand why it's a taboo issue to talk about women's health and women and sexuality, but it is a taboo issue, especially in our community. So I wanted you to kind of touch on that. And then what are some things, talk to us about the libido and increasing the libido, and why is it taboo for women, but not so much for men?
All right. So, well, I'll tackle the second part first. So I think sex and sexual health with regards to women is just the way society has played it. It's played its, patriarchal role in sexual health for women, where men feel like they can control a woman's body and a woman's, that has to do with women's rights to choose, even with, desiring to carry a pregnancy or not. I feel like, the judicial system, the white man wants to control what a woman does with her body, and sexuality also fits under their thumb of control. There's not, there's
right.
There's not, as you see, there's not, ideally it would be easier for, to have a male birth control pill than a female birth control pill, but it's easier, or it's, it takes the power away from a man, right, to control the body of a female. There's drugs and so forth that are made specifically to enhance a man's sexual arousal or performance, but those drugs are, left behind for women. So there naturally, the things that you can do to increase the libido would ideally it would be, to have the desire. You want to have a sexual desire. So we were already talking about stress. So if stress is a major impact in your life, you're not going to want to, your sexual desire is not there, right? Your libido is not there.
It's going to be like, get off me, get away from me.
Right. As women, as we mature in life, estrogen is what drives, our libido. So as you mature in life, your estrogen levels decrease. So there's been studies looking at, giving back estrogen to increase your sexual desire. But that's been linked to, negative health effects, increased risk of stroke, increased risk of, clots in your legs and your lungs. So those aren't good choices. So women are basically left with psychosocial ways to improve libido. So talking to sex therapists, talking to counselor, talking about mental and sexual health with your provider. But or you can look into, more natural remedies like herbs and stuff, but honestly, they haven't been evidence-based proven to work. A lot of women don't want to talk about, sex anymore because a woman's sexual desire is not the same as a man. Women can go, days, months, weeks, years without, having sex and don't seek anything is wrong with, not having sex. And, at least half of women have never had, a true orgasm in their life. That is not talked about as well. So, I think when you talk about sexual health, you have to be comfortable in your skin and with yourself to talk about sex. And that's what a lot of women are missing. That's just feeling comfortable enough to even bring up the conversation to their OBGYN about sex.
Exactly.
And I asked the question, but if your answer is, oh, everything's fine, or a one-word answer, then who am I to keep drilling you on something that you gave me a one-word answer for,
Exactly. No, I appreciate that because, I think it's twofold, right? So you either, desire that sexual, have that sexual need and wonder what's happening. I think after you have children, I think after you have, after you have kids, I imagine have a woman with kids that your body changes.
Absolutely.
And
your physical appearance of how you look yourself in the mirror, you may not even think yourself as sexually desirable. You see marks that weren't there before, scars, maybe weight, all of those things play a role in your desire to feel sexy and want to even engage in sex. And then if you don't have a partner that, reinforces or try to, lift up how you feel negative about yourself, then it's like, if he's just trying to stick it in, it's not going to work for you. Women need foreplay. It's absolutely proven fact. Women need their engines revved up before the action can start. A man, you can just look at him and then he's ready to go. That's not how a woman's body works. A woman just look at him.
We talk about setting the mood on accident all the time. Just walking by and accidentally setting the mood. I didn't mean to do.
Right.
Speaking of a woman's body and how it works, Ebony had a question about that too.
I did?
You did?
What are you talking about? I thought I was going to ask that.
What?
She's trying to set me up for the pineapple question. We're not
No,
we're not. Well, I definitely wasn't going to go there. Somebody,
I'm sorry.
A third party. No, but you answered that before. We asked that offline about, certain foods could help sexual performance, and you answered.
I said you are what you eat. So that's very true though. If you take in a lot of garlic and acidic food, like all of that changes the pH of the vagina. Now, eating pineapples is not going to have your vagina taste like pineapples, but it may have a little bit of a sweeter taste versus a more acidic taste. Okay, it's not about like, oh, I ate a pineapple, he gonna taste pineapples. Let's not think.
Right. I think one important note you just touched on is like, you are what you eat, and then you add on like how women's libido is really tied to how we feel and like how we are mentally. And you add back to what we talked about earlier about women carrying stress and manifesting stress in a different way. It almost sounds like if you aren't really taking the steps to do self-care, especially during the pandemic, you're probably not, it's not a good ecosystem, right?
Right.
Yeah. So
and wine for me, right? So that means that's what's coming out. There's a lot of wine coming. There's a lot of wine. That's what I am right now, walking bottle.
But then you're like stuck in the house. You can't do the things that you normally do to make yourself feel good. My eyebrows look crazy. My toenails look like fingernails. My nails look crazy, and I haven't had a grooming in that area, right? So what makes me want to go out and have sex, right?
Right.
And I'm looking at things like there's like a pathway to hell down there.
Yeah.
Yeah.
I definitely think there's some grace that needs to be passed around for ourselves and for each other. And again, just to kind of harken back to what you said before about sisterhood and having a circle, like that's important because everybody's eyebrows are messed up, sis. Like we are out here struggling,
and just not real.
Yeah.
So go ahead, Ebony.
Well, we talked about in your intro about how you are an advocate for women's health, of course, but also we want to talk a little bit about access to healthcare. I know there are a few listeners who have foregone, healthcare because the only option will be private healthcare, especially, in the entrepreneurial realm, where you don't have that corporate America benefits package. So what ends up happening is first thing to go is insurance. Can you speak on the importance of access to healthcare from a preventative standpoint, not necessarily like once it's too late, but just from a preventative standpoint?
Right. So for women, ideally, if you in your age group, so let's talk about our age. We're not quite yet 40, so we're before 40. The most important things to get is your Pap smear, which screening we do every 5 years, depending on your history and the results of the test, and STD screening, yearly. These services can be done at Planned Parenthood, which is why we need Planned Parenthood. Planned Parenthood is not just for termination of pregnancy. It is for women's health services that are affordable to, the average person who doesn't have insurance. Working in academic medicine is different than working, in private practice. Academic medicine and working at a city hospital, like, we have what's called indigent care. So patients who come in without insurance, they can sign up through the hospital for indigent care to cover the cost of their insurance or of their medical procedures and surgeries, which is paid from the city budget. But again, I'm not in a private practice. In a private practice, that can't work, right? Because you're trying to make revenue because you have to feed your staff and yourself, right? Taking advantage of Obamacare when it was the enrollment, that helped a lot of folks with being able to have access. But I feel like I just want women to realize that, Planned Parenthood is not strict. It's not just for medical termination. If you don't have insurance and you don't have a OBGYN or another women's health provider, that is a resource that you can use and is a resource that's affordable as well. And it is important, to get your Pap smears and your, when you hit 40, your annual mammograms. So those are things that you just should not, put off, because, the Pap smear is our best tool to prevent cervical cancer. And, to have to get it once every 5 years, in a normal patient who has normal screening, that's different than having to used to get it every year. So once every 5 years is feasible for someone to do.
Yeah. So basically, there are resources out there.
Oh, absolutely. There are. Now, you can end up, see, that's the thing is, when you think of you don't having insurance, you think that you're not going to get the best medical care, right? You're like, oh, I got to go to some backyard clinic. I don't have insurance. So, the doctor looked at me like, here it is and get out, right? So I'm not going to act like that's not true. That doesn't happen. So, but you should try to seek out, folks that look like you. Like I keep trying to say, with all these increased rise in, Black maternal death, my thing is there's so many Black OBGYN females out there that you can choose from. Why aren't you choosing someone that looks like you? We are at the forefront of trying to make sure our Black women stay healthy during pregnancy and delivery. So why wouldn't you go to someone who looks like you? It's like our people sometimes think in medicine that white is right, and that's not always the case. I'm very well trained. I trained at Mayo Clinic. That's the number one OBGYN program in the United States, And yet, and still, I have, patients that look like me that don't want to choose me because they look like me. You know what I mean? Like, so.
That's sad.
But it's very true though. It's a stigma that, we have kind of internalized in our own selves, like that. In order to get the best care, my doctor, has to be, Caucasian. And that's, I feel like we place that on ourselves. Like, for example, when you think of like getting a lawyer, who's the first lawyer you think you should get? A white lawyer, or should you get a black lawyer? All of that plays a role in how people think. And that's the same.
I don't even think that. I think for me, I would want somebody that is a bulldog that's just gonna go out there and fight. You would think you look at reviews first when you go out to seek this.
But it's not like that. People look at race first.
That's really interesting.
It's facts. It's like I could do a study on it. But if you polled your audience and asked them how many women had a black OBGYN, I wonder what the percentage would be.
Well,
we'll have to throw that out there. We'll have to pose that and throw that out there and see what people say. I know that in the area where demographics are just a little different.
I also think younger women, I call ourselves younger. But in our age group, I think we typically are seeking out African-American women, physicians, and so forth, because, it's a different movement for us. But like
absolutely
our parents and I guarantee you they have probably an old white man.
So real quick, because let me switch subjects real quick on real estate.
Oh God!
This is a real estate podcast.
We gotta throw in a little real estate.
We talk about socioeconomics of access to healthcare. Let's go. No, I'm kidding.
But we know that you are in the process of building a custom home rather than buying a pre-built home. What made you choose wanting to build a home versus buying a pre-built one? And then on top of that, what is the process? What have you learned in that process?
Jesus. So I know I told my husband that I wanted like certain things. Like I wanted a large backyard for the kids so we can have a pool and stuff like that. And living in Nashville, when you say pre-built homes, that's like all the suburbs, little subdivisions, and all the houses are all like, stacked up on one another, not much room, not much space. So we were always looking for land to have some space between us and our neighbors. And so we didn't find any land in developments that had pre-built homes, I guess is what I'm trying to say. Now, I don't know much about real estate, so you guys got to bear with me on what I'm talking about. So we've found the land. And then I also know that I want my house to look a certain way, and I don't think I can just find that in a pre-built booklet, because I'm struggling right now. But you should see my page on my phone. I have pictures of all types of different houses, and I want different pieces from each house to make my house. You said, what have I learned? I learned that I don't know a lot. I don't know anything. That's what I learned. I learned that it's not easy, and I thought that we would be have broken ground by now, but we haven't. And I learned that I'm learning that there's a lot of moving parts of this thing when you're trying to build from the ground up. Finding the right architect to execute your desire, and then finding the contractor that can do it, in a right time frame for the right amount of money, and then all the things that I want. And then I haven't even thought about the designer and all that stuff. It's just a lot. See, I feel stressed right now.
I'm sorry.
Just thinking about it. It's a lot of work. It's a lot of work, and you definitely need to surround yourself with the right people and get yourself a team so that you don't have to, so that you can just, kind of point and yes and no, yes, no, yes, no. Kind of take some of the stress out. It's like planning a wedding.
I was just thinking that, Courtney. Like you need a wedding planner.
I had a wedding planner for that. So I mean,
Well, She clearly
Yeah.
already has the interior,
I
help
got
already.
that part. But who's the
She got
house?
that part unlocked.
That is so funny. Well,
Exactly.
congratulations.
Oh, thanks.
That's still really
Wonderful.
awesome.
Yeah,
I mean,
that's
I know.
he's trying to come up with new ideas. He's flipping properties and stuff, trying to buy this little rundown house. And I'm like, I'm not into that. I'm trying.
All about flipping properties, Gels.
Yep. Tell them to
We
call
are
us.
all
Tell
we
them
are
to call
all about. Yep. Tell them to call us, and we'll help them out.
He just found another one that he's about to buy. And
Tell him to call us. What is Judd doing?
Does he want to actually do the work, or does he just want to own it and pay somebody to do the work?
Well, he's looking at it with his good friend that he grew up with. His friend owns a construction company. He built the houses. So together,
That's awesome.
And they're trying to get into, close to, so Nashville, obviously, like every other city, is becoming gentrified. And around Meharry, which used to be...
It's a great place to invest right now, Nashville.
Meharry used to be surrounded by predominantly, Black and low income. Now that is being obviously pushed out. So they're trying to grab up one of those houses before, there's no more.
So part 2 in segment 2 is the home and construction with Dr. Judson Wood and his construction part. Part 2.
Your face.
I like it.
He'll be on this thing and talking to you guys about so many things that you guys will be like, okay, relax now, buddy.
No, we nerd out on that kind of stuff. But
exactly. So
yeah,
do you have time? You're busy, right? You have three daughters, you're married, you have a practice, you are dealing with the pandemic. Do you have time to read? Do you because we like to do book recommendations and things like that. Mm-hmm. Do you have any book recommendations for us, or are you kind of zoning out right now?
Honestly, oh my God, the only books that I actually pick up and read have to do with medical journals and things like that. I don't have any time.
That's helpful. What type of medical journals is it for the consumers to read, or is it only for physicians?
Yes, for physicians, right? Because I'm I'm trying to always keep my practice abreast and use evidence-based medicine. So I'm always looking at published research, and it's not in like layman's terms, but unfortunately, I'm not like my enjoyment comes from reality TV. You know that.
That's real. People don't want to admit that. It's like a faux pas.
It's like a taboo.
Yeah,
no.
Yeah, it's a faux pas to admit that you watch reality television, and that's not true, because we know the ratings are out of this world. So obviously, there's not just a specific group that's watching it. For the ratings to be this high, it has to be watched in mass.
Yeah, so, and I will admit, that's a guilty pleasure. I definitely watch 90 Day Fiancé. That's my guilty pleasure lately.
Whatever you choose, I feel like people shun certain shows over other shows. Like, you shouldn't be watching Basketball Wives and Love and Hip Hop. That's like, come on, you pick one and they're all about the same. It just depends which is your flavor, cup of tea of the day. But my friend,
or whatever your escape is.
Somebody from my hometown recently wrote a book that I still haven't read, but I bought it, and I'm supposed to read it. So I will recommend that. Hold on, let me see what it's called. See, I just bought it because it's from the hometown, See,
I support
hometown, but I think it's called 12 Rounds. But she's from my town in New Jersey, and I was like, okay, I'll support your book, but I haven't read it. But I'm going to.
Well, let's big up New Jersey.
12 Rounds. That's what it's called. You can get it on
We'll
Amazon.
look it up.
You can get it on
Look up 12 Rounds, and we'll put that in the show notes. And let's big up New Jersey real quick. Try to put that in there. 12 Rounds.
Yeah.
All right.
Okay. Is it Audible? Is it on Audible or just on Kindle?
You're pushing it now.
Me too, Angelica.
No, I'm saying she didn't get that far. It's not an Audible book. It's come on now. You're pushing it.
Oh, you're funny. I like it.
So tell us, where can our listeners find you? Where are you accepting new patients? And if there are people in the Nashville area, where can we find you?
I'm always accepting new patients. I'm here to serve. Where can you find me? Meharry Medical College. You want the phone number?
No.
Yes,
No.
give us the phone number.
No,
They can
just
look
Google.
it up.
We can Google it.
Oh, you can okay, Meharry
Yeah,
Medical
Google it.
College. It's the
See, I say
women
put it out there.
women's I was a women's health clinic. It's and all my patients come through there, and I deliver at National General Hospital as well.
You have a social
I like it.
media which
And
you
my
would like to
surgeries
share?
are done at General Hospital.
Do you have a social media you would like to share?
Do I have social media? It's private. Oh, it's private.
Okay.
But, okay,
We'll cut that part out.
Well, it's okay because I accept you or maybe I won't accept you depending on how I'm feeling at the time. So it's Dr._Gel GEL. Sooner or later, I think I'm gonna have a mask that says that. I've been waiting on Catch 22 to send it.
It's been mailed.
See, the jack of all trades, she be letting some of the jacks fall by the wayside.
Oh, wow.
Oh.
See, that part.
Ask her
Thank
what
you so
plants
much,
are.
Dr. Gel, for Dr. Angelica Garrett, for coming on the show. Dr. Angelica Garrett Wood, for coming on the show. We really appreciate you for giving us your time, and it's been amazing just to hear the expertise and hear from your perspective, someone that looks like us, someone that's of our generation, and just a powerful episode. So we really appreciate you for your time.
Yeah, no, thanks for having me. I'm proud of what you guys are doing.
All right. Thank you, Gels.
Are you going to help me build my house?
Good evening. Bye, guys.
That's all. Thank you.
Bye.
Do I hang up too? I don't know how to switch.
She'll just cut the live.